Hi there, I'm Theo, and today I'm going to be talking to you about the 7 questions you must be asking when identifying and mapping your digital KOLs. So question 1, have you defined what constitutes a digital KOL? So this doesn't just have to be a traditional HCP that's active online. It can be anyone with the power to influence your work. So this could be a nurse practitioner, a patient advocate. It could even be a mother with a child with a rare disease. So anyone with the power to influence your work is really important to identify, and you have to make sure you're considering all of those different groups. And question 2, how are you going to segment and categorize your digital KOLs? So obviously lots of different individuals have different characteristics online, whether they're a content creator, whether they're blogging, creating video content, or whether they might just be sharing existing information to a large audience. It's important to make sure that you're segmenting them in the right way so that you can engage with them in ways that are appropriate to their specific characteristics. And then question 3, how are you measuring their impact and influence? So obviously if a certain individual has a percentage of their following being HCPs, you should be measuring and monitoring how far your message is spread along. Say 50% of their HCP followers retweet that tweet, and then further on, 50% of those followers then retweet that retweet. Then obviously it's important to know how far that message is spreading and what kind of impact and spread you're having with that data. Then question 4, are your digital KOLs truly different from your traditional KOLs? And obviously we've jumped on that, touched on that briefly in terms of identifying individuals that have the power to impact your work. But often we find that traditional HCPs aren't necessarily overlapping very much with digital KOLs in that field. Obviously there's some nuances when it comes to doctors and things like that on social media. So you need to analyze, compare your lists of digital KOLs with your list of traditional KOLs and see perhaps where there's an overlap and where you can engage in the right way with the right individual once again. Then question 5, what's the mindset of your digital KOLs? So we've got many ways of doing that, making sure that once again understanding how they are, what their perception on specific topics of interest to you are, whether they're aligned with your specific product strategy, or perhaps the alternative where they're not particularly aligned with it, they don't agree with your product. It's useful to understand that from your side and lends its hand towards engagement again. And then question 6, what does the whole community look like from an aerial view? So not just from the individual level, what is the entire digital landscape saying in your therapy area? So we're kind of giving you a holistic overview as opposed to drilling down into what that specific individual is saying. We can see what channels are individuals most active in, what types of content medium is most important and gets the most spread and views. That's important to note. So again, what the landscape is thinking and how they're behaving is something that's important to note. And then question 7, have you engaged with a specialist vendor whose core focus is this? And if the answer is yes, it should be system analytic. Thank you for watching.